Hey, you're on air.
Thank you, Eugenio. Thank you, everybody, for coming. Good morning, good afternoon, or good night, depending on where you are. We're going to begin the session on use of scientific knowledge and for decision makers in the context of COVID. We will have three presentations, actually only two, because Martin McKee, one of the invitees, had a problem, a small emergency problem, so he won't be able to be present. So we're going to listen to two important professors, Mauricio Barreto from Brazil, Federal University of Bahia, and Oswaldo Cruz Foundation, who will speak about the use of scientific knowledge in the context of COVID-19 in Brazil, and Professor Dominique Kondi from Ghana will share his experience related to the use of scientific knowledge in the context of Ghana. So I would ask which one would like to start, if Mauricio or Dominique, which one of you?
Well, I can start. Dominique can start, but I'm from Cameroon, not from Ghana.
Sorry, Dominique. Cameroon. Please go ahead. Dominique Kondi.
Okay, thank you very much. I'm very, very excited, very glad to be with you, to be a part of this World Summit on a pandemic or to end pandemic. Well, my presentation is I have some slide, but I'm having some difficulty to have the slide. But I can start anyway.
You can share it if you click on the icon with an arrow, just the side of the mic icon.
I've done it.
Great.
But I still have a screen that I see. Partager. Arrêter partage. Non. Alors, partager, on partage.
We saw your screen.
You've seen it?
Yes, but now it's gone.
Yeah, but the point is you clicked second time instead of opening up the window that you wanted to show. So don't click second time. Click only once the way you did it. Go ahead, do it again.
Do you see it now?
No, click again to share screen.
Do it once.
I've done it.
Well, go ahead, do it now. And choose your screen to share, just like you did before.
Yeah. Okay. Do you have it now?
Yes.
Now okay. Now we can.
Yeah.
Perfect.
Is it okay?
Yes.
Yes, it's okay. We are seeing it. Maybe you could put in the presentation mode.
Is it okay now?
Yes, it's fine. Why don't you just go ahead? We can see it. Yes.
Thank you very much. So I'll start with the epidemiological data for COVID-19 in Cameroon. So you see in the screen the confirmed cases 102.499. The recovered cases 98,317 deaths that you see. Active cases totalized 2,204, and cases on oxygen 67. And you see that for vaccination, for target population completely vaccinated, we have only 150.894. It means 1.1% that we have. So very, very few people vaccinated. You see the lethality rate of 1.6% and the severity rate 2.7. Now, what we can say is that as many countries, Cameroon was caught unprepared for the pandemic of this nature, speed, and scale. In a fragile health system, COVID-19 has hit vulnerable population and exacerbated pre-existing health inequalities in our country. The elderly, particularly with non-communicable diseases, are more at risk. Then we can also say that main health systems weaknesses, such as the lack of a national health communication literacy strategy and low primary health care organization and implementation, have somehow influenced the national COVID-19 response in Cameroon. Nevertheless, the Cameroon population have more or less built confidence in local made and traditional medicine to counter COVID-19. And we can say so far, 9 of these local medicines have been homologated by the Ministry of Public Health. Now, the controversy among scientists on COVID-19 turned into a worldwide scientific war that got the public confused, giving way to misinformation, fake news in both conventional and new social media. Even within countries like Cameroon, scientific knowledge was far from gathering a consensus among scientists. Then, how can health policies be based on scientific knowledge with such controversy? This is the question we ask. People are still questioning the origin of this disease and why insisting on immunization with so few cases and deaths in the region and particularly in the country. As medicine practice in Cameroon is more curative care oriented, scientific knowledge for COVID-19 focused mainly on biology and epidemiology than on social, environmental, and behavioral knowledge. This is what we've noticed. The research for vaccine production globally did not go along with behavioral research for vaccine social acceptance in order to minimize hesitancy and refusals. And at country level, authorities tend to impose vaccination without adopting a vaccination coercive legislation and health policy. This is aggravating reluctance of the population against vaccine. The innovative vaccine production process that differs from the one used for previous old-time vaccines, with more time for testing before use in vaccination programs worldwide, was not widely explained even within the scientific community. Now in Cameroon, the vertical or the top-bottom communication approach, usually called governmental communication, based on decision and instruction without main social and political stakeholder consultation, led to behavior resistance to preventive measures and later on to COVID-19 vaccine refusal. Social and interpersonal communication has been and remains the main weaknesses of the COVID-19 response in Cameroon. Now, question we say, how can a country succeed in convincing its population to accept COVID-19 vaccination with a spread of fake news and misinformation, multiple vaccines in the same country without official preference, and also without a sound national communication strategy? It's a question we ask. As strategies to promote the scientific basis of health policies, we suggest the following to countries. We think there is a need to develop scientific knowledge in the fields of the 3 core public health services. It means prevention, protection, and promotion. Then to develop, promote, and use traditional knowledge by strengthening sound collaboration between conventional and traditional medicine. Also to share research findings and innovation with the society. And finally, to use knowledge generated by scientific and traditional medicine research for legislation and policy design. As concerns the role of researchers, because scientific knowledge is for humanity, and especially in the field of public health, it should provide guidance for promoting health, protecting health, preventing diseases, and surveillance. It should not remain an exclusive own property of the scientific community. Then innovations in science must be accessible to the population for whom it's generated and should be made known by the public. Researchers should be given more resources and consideration. Thank you very much.
Thank you, Professor Dominique Conde. I would ask you to stop sharing your screen.
Yeah.
And I'd like to invite Mauricio to his presentation.
Okay, I'm trying now. Yes. Oh, sorry. I'm trying to. Yeah. Are you seeing my screen?
Yes.
Yes.
Yeah.
Okay. Thank you very much for the invitation to be here. It will be a pleasure to comment something on science in Brazil. Yeah, and science. I put in my title side and pseudoscience in Brazil. Well, only to give some information on the situation in Brazil. Brazil was a country with a very large number of cases. Brazil is a large country. Is expect a great number of cases, but when you put in contact, Brazil have really a very, very high position when you compare with other countries. For example, here on the left, you have the cumulative incidence in Brazil compared with other countries. For example, the European Union was lower than the UK and US, yeah. But maybe it's due to problems of diagnosis. A lot of the cases are tested, verified in tests, yeah, and probably there is lower tests in Brazil compared to these two countries. When you go to death, yeah, is in the side. This is the rate, yeah, it's not the absolute number. Yeah, Brazil is a champion in terms of that rate. Yeah, when you compare with other large countries, yeah, or European Union, even India, yeah, that is a more comparable large country also that have a really smaller number when you compare to Brazil. In total now, Brazil have near registered 22 million cases and over 600,000 deaths. Yeah, in the moment is decreasing. Yeah, incidence, yeah, on the left and deaths on the right. Yeah, you see that all the rates are decreasing when where is still so lower and is expected. Yeah, there is some expectation that what is going to happen in the next weeks and months. Yeah, given that the number is lower than before, but is not yet a comfortable situation. Yeah, you see here on that, yeah, there is in a period this year that arrived to over 4,000 deaths, yeah, per day. Yeah, was really a extreme number. Yeah, you imagine 4,000 deaths per day. Yeah, there was a huge pressure on the health system. Yeah, Brazil have a health system, a national health system that was created some decades ago and is in development. And this system was in part responsible, yeah, to the impact of the pandemic can be not so extreme as expected. Yeah, the way that the system is organized and decentralized, yeah, in some way was responsible to support the high burden generated by COVID. Yeah, here you see the vaccination. Brazil is growing after some period of and there is a long history that I'm going to talk later. yeah, the vaccination, Brazil is here, and in terms of double vaccine, yeah. Brazil is near 60%, is arrived to 60% in adults, yeah, with double vaccine. That puts Brazil in a more comfortable situation in terms of severe cases, yeah, and this yet growing, because the hesitancy got the vaccine in Brazil is lower than some developed country like US or even in Europe, yeah. Then maybe if you continue in this path, yeah, the coverage might be equal or even higher than some developed countries. But I'd like to talk about science. Now, science in Brazil was thriving, yeah, in the last few decades. Brazil have a large community, a scientific community, very large, in different fields of science, yeah. There is really a very significant scientific development, yeah. New universities were created, yeah, in the past 20 years. Yeah, there was a huge expansion on the scientific community and in the infrastructure for science, yeah. The funding for science increased, yeah. And also there was a very positive relationship among policymakers and scientists and researchers, yeah. This was an important part, yeah, that a very positive thing. This is a more virtuous relationship, yeah, among these two groups, yeah. But in the present government that now is in the third year, things change completely, yeah. You used to have during a long time, yeah, center or left government, yeah, that were build this positive environment. And now you have a very much right-wing government, yeah, that changed completely, yeah. And the relationship among the policymakers and scientists deteriorate completely, yeah. The government, yeah, agencies in general are completely closed for science, yeah. And the funding for science collapsed, yeah. There is really you can't talk on collapse, yeah, because it was so much cut, yeah, that you can call collapse, yeah. And the COVID-19 crisis arrived just in this moment, yeah, that science in Brazil have flourished for some time, and have a large community, and then the fund was in collapse, yeah. And then what you saw in these 2 years of epidemics is a scientific community yet very active, and they try to contribute in different ways, yeah, to the development. If you see the scientific literature, yeah, there is important contribution of Brazilians, yeah, on different fields, yeah, on clinical development of medicine, test of new medicine, yeah, on modeling area, yeah, different areas, yeah, that the science related to the pandemic evolve, yeah. There is Brazilian groups, yeah, alone or in international collaboration, yeah, contributing, yeah, to that. But in other side, there is a government that trying to impose its unscientific views, yeah. And then there is some point that I'd like to stress, the concept of mass immunity, yeah, that is a concept that was a lot discussed during the pandemic, yeah. That was really our government, yeah, and you see that this was common in the right-wing governments in different parts of the world. But in Brazil, then they took this idea in the last instance, yeah, in the maximum, yeah. And then with this idea of mass immunity, yeah, there was a lot of implication. One is that there's no need of social distancing measures, yeah. Then the federal government, yeah, was really against the social distancing, yeah, and they try not to support that, yeah, despite the as you saw, the management of the crisis on the state and municipal level was different. But the federal government tried to block initiatives, yeah, to increase the social distance, for example. and stimulate early treatment. Then this is an important part of our history, yeah. And they stimulate the use, yeah, of chloroquine, hydroxychloroquine, ivermectin, azithromycin, corticosteroids, yeah, during the initial acute form of disease. I'm not talking about the hospital treatment. That is different problem, yeah, that is more controlled, and it's a different, yeah. I'm talking about people with acute, yeah, in ambulatorial form, yeah, that the idea is that if you give early treatment, yeah, you protect the people to have severe forms, yeah. And then the government and even the Ministry of Health of Brazil, yeah, stimulate what was called here kit COVID, yeah, is a package of drugs, yeah, that was distributed, yeah, widely, yeah, in different parts of Brazil, yeah, to with the idea of this early treatment now will stop the development of disease. And even after this started past year, but even after the scientific conclusion that the chloroquine or hydroxychloroquine was completely ineffective, yeah, they continue to justify that, and in the international arena, yeah, there was a lot of very strange meta-analysis and the other things that stimulate the views, yeah, that these drugs were efficient. Then it was a national problem. I think this forum is important to us discussing, because this question was very national. Was here, maybe in Cameroon and the other countries worldwide, South Africa, other Latin America countries, yeah. But there is a world, yeah, relationship, yeah, that gives support to this idea. But in Brazil, it arrived at one point that maybe other countries, that was the support for unethical trials, yeah. For example, in the search for new treatment, yeah. For example, there is a proxalutamide. Proxalutamide is a drug used in prostate cancer, yeah, that shows some experimental effect on decreasing or against the virus, yeah, but in lab, yeah. And then some groups start to test that, yeah, in people. Even Brazil have a huge control, yeah, ethical control, have a national system of ethical control in research, yeah. But despite that, and with support of some mechanisms, yeah, these people conduct this trial, yeah, that is completely strange trial, yeah, and is now under investigation, yeah, in the National Ethical Committee and the Brazilian prosecutors and the others, yeah, investigate this trial. But this happened, yeah, with support through mechanisms created by the federal government. And fake news, yeah, that was common, yeah, this was supported by a massive system of fake news. And then you saw in the international, scientific and no scientific publication about this, yeah, about the effect on science, the pseudoscience suffocating Brazil, the crimes against humanity, yeah, the anti-science role of the federal government, yeah. And about the kit COVID, there is publication about that. If someone is interested, yeah, here is a public in the Lancet Regional Health Americas, that these two authors, they give a brief history, yeah, of this use in the context of Brazil. And also about the proxalutamide, yeah, a question that now is in a international discussion by bioethics committees and the other groups by UNESCO, yeah, that focus, yeah, to understand what's happened and try to prosecute the people who did that. Yeah, and to complete this picture, because the picture is so negative that the Brazilian Senate create a parliamentary inquiry committee that just presented the report 1 week ago. Yeah, and among other decision, the senator decide to indicate the President Bolsonaro for 9 different crimes. Yeah, you see how big it is problem. Yeah, you see the list of the crimes. Yeah, is that the senator sank. Yeah, that the president could be included in. Yeah, these inquiries is now transferred by the Brazilian prosecutor that to see if there is a way to go to advance for a justice investigation or not. Yeah, then you are in this stage now. But the report is clear. It's a very complete report. Yeah, showing great details. Yeah, and there was a deep investigation. How the mechanism of the states, yeah, even a complex state like Brazil, yeah, were used, yeah, by this government, yeah, and to try to even going against science and try to defend their own ideas. Yeah, the only thing positive in Brazil in terms of control, yeah, that the control of COVID was conducted by state and municipal governments. Yeah, and Brazil is a federative republic. The state have a great deal of autonomy. Yeah, and the municipalities also. Then the control, yeah, all the policies, yeah, of control. In fact, yeah, the great policies were conducted by state and municipal district or government, yeah, and several of them organized their own scientific committees, yeah, even municipalities, large municipalities, they created like Niterói, for example, Rio de Janeiro, they create scientific committees, yeah, of members of the local scientific communities, yeah, to help them, yeah, to go and to take a more rational decision. Yeah? And here, where I and Luis and Elijah live, yeah, that is the northeast region of Brazil, is the poorest region of Brazil. This region is composed by 9 states, yeah, with a population of over 30 million people. And the government of this region are organized around what they call Consórcio Nordeste, Northeastern Consortium. And they organize their own scientific committee that I'm a member of that committee, yeah, and to try to have a more well-informed decision, yeah, to support them. Inside the scientific committee, for example, in this scientific committee, we organize subcommittees, yeah. One of these subcommittees that I coordinate is a epidemiology subcommittee, that Elijah, that is here in this room, is also part of that, yeah. And this subcommittee was in charge to do analysis and interpretation and to understand, yeah, some questions, yeah, or give more information to the governors regarding some question that need to know the what's going on worldwide, and also to interpret some local data. Then what was positive in Brazil and show the capacity, yeah, despite the federal government, was the action of the local and state and regional governments. Okay, thank you very much.
Thank you, Mauricio. I'd like to ask Dominique if he's following the session.
Yes, I'm following.
Are you following? Oh, it's okay.
Yes. Yes, I'm reconnected.
Oh, great! Thank you. So we had 2 presentations from Cameroon and Brazil about the use of scientific knowledge, and also a panorama overview of this pandemic situation. I would like to open the floor for questions or comments from the audience, from our colleagues that are in the room. If you have any question or comment, please open your mic.
The people who are in the second row may not be able to speak, but they can post in the chat. Let me actually fix it.
Okay, may I begin? I'd like to ask Dominic, what about the relationship between the traditional medicine and the traditional folk knowledge that seems to be very important in Cameroon, and how does it relate to the Western, as we can say, scientific knowledge, and which kind of influence do these two kinds of knowledge had in the policies, in the health policies, to tackle the COVID pandemic?
Well, what I can say is that, let's say, the traditional medicine is not yet, let's say, institutionalized, because we still are waiting for legislation. Since many years, the Ministry of Public Health is trying to make sure the Parliament adopt, let's say, a legislation on institutionalizing traditional medicine, but we've not got it up till now. So that we have a very important practice in traditional medicine, and the majority of the population believe in this traditional medicine. And I can tell you that many people, where they are sick, they first think of traditional medicine before conventional medicine. So let's say the relationship has not been good for many years. And I think it's this COVID-19 situation that is trying to bring these two medicine together. Let me say, at the beginning, at the onset of this pandemic, the first reaction and these people were not into. People of traditional medicine they have been trying to compose their own treatment, prevention and treatment of COVID-19. And then with time, the Ministry of Public Health went to meet them and tried to listen to them, to understand. And since the government had put in place, let's say, a scientific committee, the government asked this scientific community to try to have a ear, to try to listen to these people and see if what they are doing can have sense. And this is why I think with this COVID-19, we are seeing that, as I said in my presentation, we have now 9 traditional medicine. That's a medicine from the tradition and the locally made medicine that have been homologated by the Ministry of Public Health and that are used. People and officially used now in Cameroon. So we expect, and we opportunity that we have to see conventional medicine and traditional medicine working now together should go further to be institutionalized, and then with a legislation, so that this practice, this medicine, this traditional medicine practice should be on air. Thank you.
Thank you very much, Dominic. I'd like now to ask Mauricio and also Ligia. They are part of the scientific committee organized by the governors of the states of the northeast region of Brazil. Which were the most challenges, the biggest challenge, the more difficult task, the most difficult task to make the scientific knowledge orient and form the policies of these states? I don't know if Mauricio and also Ligia would like to comment, and this experience of the scientific committee for the governors of the northeast states of Brazil. What did it work well?
Yeah, the
Did
work
it,
is reasonable well. Yeah, I don't say well. Yeah, because there is also a misunderstanding what is science by the politician. What is science is interpreted by a very pragmatic way. Science will give answers, specific answers very quickly and very efficiently. Yeah, and do not understand the process of science. Yeah, sometimes even in particular in the course of so complex a pandemic, that people do not know so much. Yeah, and part of this, the role of a scientific community is to review evidences, yeah, and add something to the local context, yeah. Then this takes time, yeah, to process, to analyze, to discuss, and to interpret, yeah. And the politician, they want to have this very quick, yeah, in time. Also, understand what is science in terms that I think this is was a huge problem in this pandemic. Yeah, the science is not a generic term. Yeah, you have fields of science. Yeah, a scientist in a field, yeah, is not don't know very much about the pandemic. Yeah, that you need some specific knowledge. Yeah, that to think on the science of the pandemic. Yeah, but this was a bit mixed. Yeah, science is a big issue. Yeah, and a common topic. Yeah, that is scientists that you answer the all the question. Then I think there was some confusion. Yeah. But in some, I think in the at the end, is an experience, yeah, to work, yeah, and the important political decision. That is science is important to guide the decision of the politician. I think this is symbolically is very important, yeah, to give some space, yeah, to science to be part of composing the political decision. I don't believe that as some did, yeah, some does, yeah, that science will answer every question, yeah, but as scientists, as researchers, you can understand some problems in great details, yeah, and if you interact with the politicians that are more clever, yeah, they can use this information, yeah, to take and to implement a better decision. Then I think if there is a dialogue, among politicians and scientists, yeah, and a comprehension of both sides with the limit and the possibility of contribution of each side, this can be a very much positive development.
So should I?
yes, please.
Talk on it? Yeah. So one thing that I was important in this experience in 2020, when the pandemic first came, nobody knew many things about that. So we are just dealing with the unknown virus. And in that time, the governors, it's important to put some context in this. Northeast is a region in Brazil, one of the poorest regions in Brazil, and vote against the president. So the president really doesn't like us. And that's why before the epidemic, this consortium that Mauricio cited here was organized to try to survive this new president. And so in 2020, they used this consortium to have this scientific committee. And the scientific committee discussed lots of things, and they really follow much better than in the second and third wave in 2021. In the new period this year, they were more, they knew more about control. So every state worked more separate instead of together. and they knew how to calculate the effective reproduction number. So they are following these numbers, they are following these things, and almost no state did the test and tracing and isolating patients, even when the test became available. So this is still some issues in Brazil. Just a few I'm going to talk next. I'm going to give some examples of a few municipalities that really, really use that and have a great success, even they didn't have the vaccine yet. So it's was a great experience, but it's very hard because they suffer pressure all the time. For example, the last issue that the coordinator, the government of Piauí, is the coordinator of this consortium. So he wants us to define the end of the epidemic, like this was really possible. No. They don't understand very well these things. None of them is from, if I'm correct, none of them are from the health area. So it's very tough for them to follow the instructions, to follow the recommendations, and really succeed with that. But well, I'm going to show here in the response that the consortium really works, especially in the beginning, orienting, and we are sure we saved many lives with this.
Thank you very much, Ligia, Mauricio. Dominique, there's a question in the chat for you. In South Africa, a study found a strong correlation between age and vaccine hesitancy. Younger people were more hesitant than older people. However, the strongest correlation was between connection to the internet and hesitation. People who had internet connection and in data were more hesitant. Does this parallel Cameroon?
Well, this is true. Let me tell you that at just the beginning, at the onset of the pandemic in Cameroon, as the president of Cameroon Public Health Association, I sent a message. Let's say it was a sort of position paper that we wrote, Cameroon Public Health Association, to address to the Minister of Public Health, telling him that COVID-19 is, let's say, an epidemiological problem, but also a behavioral problem. This is why we thought, because we noticed that there was a scientific committee put in place, but this scientific and the response that was written was not oriented towards behavioral aspect. So we thought that this was very important. Why I'm saying this? I'm saying this because, when we decide, let's say globally, it's decided, we know that we are encountering a disease, a pandemic, and that you have some regulations that are global and that the countries have to implement. Now, what we should do is to make sure at country level, we bring together all stakeholders, scientists of many disciplines, and even traditional medicine, even the other civil society, and then have a meeting with them and tell them this is the situation we have globally and now in our country. And this is what we intend to do, so that these people understand and accept, and then they go to the field and explain it to the population. When we don't do this, when we don't put together these people, we decide as a government to do this and don't do this, people are not informed. So now this media, let's say the social media, are the first to give information. They are the first to give, and the information they give is false. Sometimes it's false, not good information. There is misinformation. People receive first this information and messages and fake messages from these social media. And then when after the government starts informing people through conventional media, people don't believe. And this is why many people who follow the social media are reluctant. They don't accept the disease. They don't accept the vaccination. This is what I can tell you. And this is true for Cameroon and true for many African countries. Hello?
Yes. We heard you.
Thank you, Dominique, for your comment. And Mauricio, how the scientific community dealt with the fake news in Brazil that were so politically important? There were reactions or organized reactions from the scientific community, entities, associations to face the pandemic.
Yeah, I think fake news is yet a problem. I don't know how to be against. Nah, it's not clear the mechanism. Nah, there was a huge effort. Yeah, for example, there was a lot of groups in the scientific community that organized, in observatories, and the others, networking initiatives, yeah, and produce information that in some way contrapose the fake news, yeah. But I think fake news are more complex things that you don't understand completely the power of fake news. Nah? I think, for example, the anti-vaccine movement is a strong movement worldwide, yeah, very well articulated, very well financed, yeah, and very well supported, yeah, and explore some expectation or some delusion of some people experience vaccination now in the past, yeah, and they try to make this a movement, yeah, against vaccine, for example, yeah. And in my view, there was a huge growth. It was not because the people only relate fake news with the media, social media, but I think one different point now is that fake news are related with the right-wing international movement. The extreme right movement are really associated with fake news and using these as a political weapon. I think for me, this is the difference. Yeah, I am of those that don't see fake news as an isolated matter anymore. Yeah, but as an important political matter. They go out of the science, yeah, and now is a political weapon that is used, yeah, to explore feelings, yeah, of people, and they associate this with the extreme right ideas. This is very clear, yeah, when worldwide, right-wing presidents and prime minister, yeah, absorb, yeah, this fake news, or when they not promoting fake news, yeah, then show this interrelationship, yeah, between fake news and politics. I think what the investigation is done, yeah, to understand, yeah, the mechanism. For example, the financing mechanisms, yeah, the media, the social media as make possible that a lot of people profit, yeah, from the anti-vaccine movement. Even in Brazil, there I studied for a group in a university in Brazil that they show clearly that the anti-vaccine movement in Brazil, they have huge profits, yeah, on when you see that the sites, yeah, are profitable in different ways, yeah, by marketing products and things, yeah, or general interests, yeah, that they defend and profit for that, yeah. Then is a very complex thing, yeah, that I think extrapolate, yeah, the scientific community. I think the scientific community continue with the role that is to produce information, to filtrate information, good and controversial information, yeah, but to contrapose to the fake news is really well beyond any scientific community anymore.
Thank you. Let me
Thank
just
you.
point out that we're at the end of the hour, and I know we started a little bit late, but should be usually a little bit of gap for people to switch sessions. So if you could wrap up this session, and anyway you're transitioning to a session that has the same chairs, then please note that there are other sessions. Sorry, there are two other sessions happening after the hour in Share SB and Share SC. So welcome to transition when you're ready.
Okay, I'd just like to thank you again. Thank you very much indeed for Dominique and Mauricio for their insightful comments. And we are in the room already with two members of the next session. Professor Lígia Kerr from the Federal University of Ceará in Brazil. She's here in the beginning. And now we have the president of Abrasco, the Brazilian Association of Collective Health, Professor Rosana Onoco Campos, who will share the next session. We're still waiting for the two other panelists, Dr. Avril from Ecuador and Dr. Christian Reboledo from Chile. So let's wait for some few minutes, maybe to see if both of them they are joining us for this session. I just I sent earlier. I sent message, but I got no reply from them. So anyway, I will give the floor and the answer to Rosana that will share this session. Welcome, Rosana. Thank you for accepting the invitation.
Hello, good morning, everybody. I'm very pleased to be here representing our Abrasco and showing those friends like Luis and Mauricio and Lígia. I think that we can wait 4 or 3 minutes to the other members of our...
Yes. Lígia left us. Oh.
I was lost in the cyberspace, but I get it.
It's a very interesting platform, but you need some time to familiarize to get to understand it.
Yeah, it's necessary some training,
Yes, it was
to move around. It's very nice, but yeah, needs some training.
$15, 20 minutes for each speaker. Luis Eugenio?
Yes, I just got a message from our colleague from the Public Health Association from Chile, saying that Dr. Christian Reboledo had a emergency problem, familiar problem with his kids, so he won't be able to be present.
Wow. So maybe we can give a 30 minutes for each of our participants.
Yes.
Okay. Lígia, do you want to begin?
If you are going to speak, could you please just drag yourself over here, where I am now, so I can see you better.
Do you want to start?
Hmm?
Do you want to start? Who's going to start?
Can you start, Lígia?
You asked me to start?
Yes.
Okay. Sorry. I was trying to, I left by mistake.
We are
I have to come back.
with this platform. Okay.
Okay, I can start.
Thank you very much
thank
for
you very
joining
much.
us, Ligia.
Yeah, thank you. Thank you for having me here. And I'm very embarrassed about talking of a response in Brazil, since Mauricio already gave some of the terrible pictures we have here. So let me share. Let's see.
Sorry.
Okay. Can everybody see that?
Yes.
Okay. So what they asked me to talk is how Brazil respond to COVID-19 pandemic. Mauricio already said some important things and focus more in science. I'm going to focus in response to the pandemic in terms of saving lives or not saving lives. Yeah. So the president and COVID in Brazil. Bolsonaro is our president and is identified as the worst pandemic manager in the world. Brazil has the second highest death toll in the world after the United States. We now reached almost 22 million cases and 608,000 deaths. A company established an index, COVID performance index, that ranks how 98 countries with comparable publicly available data, how they manage the epidemic, following the 100 confirmed case. So the one that this was in 2020. The best country was New Zealand, and the worst, Brazil. Can you see in the bottom here, there? So we were the worst. And I tried to follow this index. Brazil is no longer there. So our president is author of a very embarrassing quotes, like the people are overestimate the virus, has hysteria, it was a little flu, it's starting going away, and or so what do I have to do with this? And call Brazil land of sissies. So this is really capable to do everything. And when the vaccine was being discussed, he said, if you become an alligator, I have nothing. It's your problem. So people really make fun of that. People get into the vaccine room and becoming an alligator. And talk about harmful masks and implement hydrochloroquine in the country. So municipalities with more votes for Bolsonaro presented more death in 2020. So if you see here, this is the rate of social distance. Those who do not support practice more the social distance. The one that support practice less, and they died more. This was also found in the United States. So the president prohibited implement of prevention measures, would use masks, social distance. So governors have to go to the Federal Supreme Court that in April 2020 just established that all the states have the power to set up their own rules. So this is what happened. The COVID-19 was put in their laps, and they have to do everything by their own. And we have some governors that implement in that time non-pharmaceutical intervention and succeeded. We have the example of Northeast Consortium that Mauricio mentioned. I'm going to show you some examples. and the city of Araraquara, Niterói. I'm going to give some examples of best practice of governors and or municipalities. So one good thing we have in Brazil that, thanks God, doesn't depend so much of of course, depend because the fund comes from there. And in 2007, they frozen the fund for our unified health system. This we call SUS. So SUS is one of the largest and most complex public health systems in the world. Ranges from simple care like blood pressure assessment through that is taken care by primary care to organ transplantation through tertiary care. Ensure comprehensive, universal, and free access for the entire population of the country, no matter you have or not health insurance. The management of the health actions and services provided by three entities of the federation: the federal government, the states, and municipalities. Together, they have to take care of this. Oops. What did I do here? Oh, sorry. So one of part of the SUS is named UPA. They are secondary emergency units. These emergency units is part of the emergency care network. Concentrate healthcare, intermediate complexity. Primary care, hospital care, home care, and mobile emergency care service that we call SAMU. SAMU was very important because the ambulance goes and takes people from the house and takes or accident and take to the hospital. UPA is a 24/7 unit that offers a simplified structure: X-ray, electrocardiogram, laboratory exams, and observation beds. And this was really, really very important during the pandemic. They became something more complex during the worst period of the pandemic. The other good thing is the intensive care unit had 25,000 additional beds between February 2020 and January 21. So these areas in red were implemented with 11,000 beds of ICU beds. But as I said, in 2021, the federal ICU bed funding was reduced at the worst time of the pandemic. So President and members of Parliament did not vote the budget for 2020. So the number of care units, intensive care units for patients with COVID funded by the federal government drops 73.5%. This was the worst period of the pandemic in Brazil, was when Gamma variant hit Brazil. To show some examples, we see here Goiás and Amazon with a huge decrease of beds for ICU. So here is an example of a success with the Northeast, the consortium in Northeast that Mauricio mentioned. We show, we provide scientific information and they follow the information. Here's an example of one of the states. You see, increase the social mobility index, increase the isolation, the reproduction daily number went down. And what happened, this was the estimate curve, how should it go without anything done. And here is a curve of observed case. This is how much we dropped. So many lives were saved because this action of non-pharmaceutical interventions. Here's another example two cities, one close to the other one. In this period, the variant that was done in Manaus with a completely uncontrolled, because the government didn't control the epidemic. There is lots of hypotheses how this get into that area in São Paulo, because Manaus is very far in north, and São Paulo and Bauru and Araraquara, these two cities are in southeast, so more than 5,000 kilometers. So one hypothesis, a van came, a tourist came from there and dropped in Araraquara. So Bauru defends that open of the stores was not to be done. They have to open the stores, not close. Do not to lock down. Declares that lockdown doesn't work for Bauru. Support a car parade that's called for responsible opening for local commerce. In February, the mayor said everything should be considered essential after nearly a year of pandemic. So she really did not do any lockdown. Araraquara, very close to Bauru, had a completely lockdown. This is a picture of Araraquara in that time. So they made a completely lockdown that suspended all the service, include public transportation and entering to supermarkets. Only delivery was allowed. So the result was, this is the purple is Bauru, the one that did not do the lockdown, went up here with the gamma, up in internations, people in the hospital, and increased the death. And the orange is Bauru, that even with a very, very infectious variant, controlled the epidemic much more successful, came down in the death. So the other thing is the crisis of vaccine. Brazilian government could have ordered 200 million doses from COVAX initiative. Pfizer offered to sell 70 million doses in advance. He refused. The health minister announced to purchase 46 million doses of Coronavac from Butantan, one of their major producer of vaccine in Brazil, but the president didn't allow. Diplomatic friction with China and India delayed the delivery of active pharmaceutical ingredients. So Brazil could have faced the epidemic with 316 million doses of vaccine, enough to vaccinate 78% of the Brazilian population. And we couldn't have that. So after fighting a lot in the fourth, in 1 year, fourth Minister of Health, this Minister of the last one said, I can be your Minister of Health if you let me deal with the vaccine. So finally, Bolsonaro let them buy. But just to compare, when we have the epidemic of H1N1 in 2010, in 3 months, we vaccinate 88 million inhabitants. No country in the world did that. In 2021, with a disease much more dangerous, COVID-19, we vaccinate at the same period of time 8.6 million, only 4% of the population. So this was really a disaster. Besides this, we have 14 million inhabitants that didn't have the second dose of vaccine. They are delayed. So recent media made an investigation in Rio why people did not vaccinate. So the reasons for delay is population mobility. This never happened in Brazil. For example, if I live in a city and I go to another city, I can vaccinate anywhere. Because the vaccine was so rare and not enough, We couldn't do that. So people, when they move to another city, they can vaccinate there. So this was one of the reasons. Fear of side effects. Don't believe the effectiveness of vaccine. Negativity was influenced by fake news, got sick closer to getting vaccinated, inconvenient clinic operating hours. So they never could go because the clinic was operating only in the business hour when they were working. So now they are in Rio, they are increasing vaccination. What's the reason they are increasing? The passport, the vaccine passport is one of the reasons. Is being required by for public events, soccer games, shows, religious events. So if you don't have, you can get in. So every time it's going to have a soccer game, increase the number of people searching for a vaccine. They put available mobile vaccination sites in subways and train stations. So when people live there, they find this mobile vaccination place and they are getting vaccine. And also being more confident as more people are vaccinated and they see the disease is decreasing. So we also have some community initiatives. I'm going to give one example. We have more than one, but not too many. Maré neighborhood in Rio is this. This is a picture. Is a huge area. Was created in 1994. It comprised a group of 17 communities, approximately 140,000 people. The region borders the Guanabara Bay and is located between important highways in Rio de Janeiro. This was a movement composed by Fiocruz, Oswaldo Cruz Foundation, Conselho Comunitário of Manguinhos, and Redes Maré Network. The name is Health Connection, Keep an Eye on COVID. Em português, Conexão Saúde, de olho na COVID. It's a partnership with Dado do Bem, is Data for Good. It's an app that they can map people with positive. They put inside the map where people positive are, so they can map the most at-risk areas. They also have other groups. SAS Brazil is composed by NGOs, also private companies that support the movement. Union Rio in health that provide also place to go, healthy units to go. They help people to manage food, what we call a basket of minimal food. They receive that. They are helped when they had to be isolated. They have a secure isolation with food and resting. People provide everything. They have tests, contact tracing, and production of this risk maps I mentioned, and guidance and support for local population, including telemedicine. With this action, they reduced by 90% the death. At the same time, the rest of Rio was living a huge tragedy. Manaus and Rio de Janeiro had the worst possible COVID because they were very badly managed. But show that an area separate can do different. Here is the queue for vaccination for COVID-19 in this part of this health connection. Oops. So the mass vaccination made Maré one of the places with the lowest transmission and hospitalization from COVID in Rio, in the whole Rio in 1991. So besides this good experience, the tragic combination of low levels of social distance, wearing masks, generates a variant that concern more transmission, the P1 or gamma. So in April 2001, all this, most of states, the Gamma was the most prevalent variant. And this was a real disaster in Brazil. It started with Manaus. Manaus, since this was January in Manaus, since the first epidemic, Manaus, many providers said Manaus was not prepared for another wave. But this wave was much worse than the first wave. So January, COVID hit the state of Amazon, and Gamma is found locally and in Brazil travelers in Japan. First in Japan. Records of death, hospitalization, unconfirmed case in COVID-19. The state experienced scenes of chaos due to the lack of oxygen. People die in the house, die in the street, die in the hospital without oxygen. 2,522 people died only in January, in one single month. Cemeteries registered lines of hearse and had to install cold rooms because they didn't have space to bear so many people. Federal government transferred patients to other states, spreading the variant. Instead of providing resource to manage in Manaus, they spread patients in more than 10 states. And these states followed the Gamma spread. Instead of oxygen, the vice president goes there and talk about the COVID kit with the hydrochloroquine. So today, what we have, the variants detected in 5 Brazilian regions from August 29th and October 9th, about 5,000 genomes submit until October 14th by independent laboratories. There is a surveillance genomic study in Brazil from epidemiological week 35 to 40. So it was carried out by the Instituto Todos pela Saúde. Is an institute, a private institute managed by a big bank in Brazil. And was the laboratory that deposited the variant there. So show that Delta is already taken in 90%, 91% in Brazil. So this is the different regions in Brazil. You see most of them, with the exception of North, are taken by Delta, this pink one. So COVID case in Brazil. Here we start the vaccination is 1 year from November 5th to November 5th to 21. The vaccination start here, and Delta was more than 90% in this period. So here we see how Delta became the most prevalent. Here was Gamma, still was Gamma in Brazil, just a little before Delta. We think Delta couldn't get completely because Gamma produced lots of people. I think Gamma saved us from Delta. Even Delta is spread, is not killing like other countries. This was I want to say. So I studied, conducted by Health Law Research and Study Center of Faculty of Public Health in São Paulo and Connectas Human Rights. They studied from March 20 and middle January, a timeline composed by 3 axes showing normative acts of the federal government, include the issuance of norms of federal authorities and bodies and presidential vetoes. Acts of obstruction to the response of state and municipal governments to the pandemic. And advertising against public health, defined as the political discourse that mobilizes economic, ideological, and moral arguments in addition to fake news and no scientific technical information. So this is what they proved, that the president not only did not prevent or act against the epidemic, but he acts promoting the COVID in the country. Bolsonaro did not use the fund approved by the Congress for COVID-19 intervention. He didn't spend 80.7 billion reais approved by the Congress for the pandemic in 2020. Part of this money was designated to payment of emergency aid, providing amount of money to the families, poor families that were unemployed or couldn't provide food. So he is really, really terrible. So finally, what I want to show that's similar. This is a picture I found from Italy when Mussolini went with a motorcycle around the plaza, one of the plaza in Rome. And here, what Bolsonaro did was in Brazil, in Rio, recently. So these similarities are not coincidence. History, if its lessons are not learned, repeats itself. So that's the lesson we are going to take. We are taking from Brazil. Thank you.
Thank you very much, Licia. We have the notice of our participants from Chile and from Ecuador are not able to attend to our meeting. So I ask if Mauricio is still here.
Yes, I am here. I am here.
Mauricio, would you like to comment some of the points that Licia showed to us?
No, I think not. I think I agree in general with Alicia presented. Yeah, that Brazil is a case of to be analyzed regarding COVID. Yeah, a case in terms to be a large country, a complex country. Yeah, but also a case to be at the federal level so badly managed, yeah, in terms of the conduction of the crisis, yeah, then I think is a special case to be studied in the future, yeah, about how to manage so well a pandemic. And then I think this is the main lesson that you have so far from this process. But also to praise state and local initiatives, yeah, that were very positive, some of them, yeah, and was the major reason, yeah, that you have less, despite the number of deaths, the number of cases, but you have less, given the action and the local action being from government, being from communities, yeah, groups like indigenous people, yeah, the Black movement, the favela movement that in some way stimulate ways of the population to increase the protection against COVID.
Yes, that led us to a point that it seems to me that it's very, very relevant. That is about how the inequities were increased during this pandemic period in Brazil, and how will we work to solve it, because it's a very serious scenario. For example, I will make brief comments about my own area of research, that is mental health and public health. The mortality gap and the morbidity gap in the mental health system, it's already increased, and it will increase in the next years. And it's something that our system, the SUS, as we appointed, must need to show and to plan to face it, because it's a very, very tragic situation. The social determinants of health are relevant in mental health, for example. And we know that it does exist a circle that feeds the poverty, mental health, and social exclusion wheel. So we need to interrupt that. And the only way to interrupt this kind of vicious circle is with public policies. So we will need a very, very important agreement between the social forces, the political forces, and all the academic field to make some priorities in order to reconstruct the situation in the next government. That's what I hope it will be another government and not that of Bolsonaro, of course.
May I say something about this?
Of course.
So there is we are studying health professionals, COVID-19, and among health professionals. And one of the topics is the mental health. And we found that in general, we still did not adjust the data, requires some adjustment, but we found about 40% of health profession with some mental issues. And comparing to, I think the municipality asked a company to, like Ibope, but works locally in Fortaleza, and they interview almost 2,000 people randomly, and they showed 80% of mental problem. So it's much bigger than the health professionals. So my hypothesis is the health professionals live very stressful moments when the epidemic is high in their place they work, and then they relax and they have a little more control after the beginning. They have more control with EPI and protection, and seeing that most of them infected and died. But the local population, they are afraid of not have what to eat. If they can't go out, they don't have what to eat. They are afraid of the violence. If I don't leave to work, I can decide if I'm going to die with a shot or I'm going to die hungry in the house. So it's really, really very, very interesting, and very, very sad.
Which take us to the point of social networks and social protection in our country, because in a very unequal society like the Brazilian, the capacity of resilience of the people is threatened by the lack of confidence in the state's policies. And in the Brazilian context, in many neighborhoods, that is worsened by the strong presence of state violence in form of policy violence, structural racism, and structural gender inequality. And there are a lot of studies showing the consequences of this situation on the public health access, on the recovery gaps, and in the treatment of many diseases. And this is a very serious and ethical issue that we must deal with in the next future.
Yeah. It's incredible.
We will also have a very high impact in the young people. We have studies showing that in the young people, the mental health impact was worse, because to be young, you need to have hope. You need to have plans. And in these last 3 years, the young have lost a lot of contacts and social relations in the schools. We have had an increase of the suicide attempts, of the experience of cutting themselves, and rising rates of depression. And we need to focus some policies on this specific group, because they are the future of the nation.
Yeah. I don't think they feel like that.
Also the children, because we have had one of the longest period without school in the world. And this had increased a lot the inequalities, because we know that poor families have more
Oi,
difficulties
bom
to
dia.
get the
Oh,
schooling by the internet than the rich families. So we need some specifically propositive policies to allow the catch up of these children, because if not, we will have merely how to say, we will have this gap, this social gap, this inequality gap, bigger and bigger in the last decades. It's not a problem
Yeah.
from a year or two. It's a problem for having a proposal for our future.
Yeah.
Yeah, may I, Rosanna?
Of course, Luis.
Thank you. Uh, yes, you both are raising very important questions, and because you have the idea that the problem is not only the COVID pandemic. We continue to have the pandemic, the infectious disease, but it comes with a lot of other problems, mental problems, as you have raised, but also chronic conditions that are increasing numbers of cases. People has delayed the treatments and the preventive actions related to diabetes, hypertension, and even in the case of COVID, you have the long COVID. A number of people that
Yes.
are still with symptoms are feeling bad and have problems. I would like to raise this question. Ligia made a very good presentation about the SUS, the Unified Health Systems. What could we see? What can we see about the preparedness of SUS, of the public health system, our national health systems, to deal with all these problems, mental problems, infectious disease, chronic disease. Are you seeing in the scenario any movement from? We know that from the federal government we see nothing. Actually, we see distraction, we see omission, but do you see from the states or from the municipalities any initiatives trying to reorganize the health services in terms to deal with the continuity of the pandemic, but also with this new problem? I'm making this question because of the experience we're having with the Northeast Consortium. So it seems that the regionalizations and the collaboration between the state governments and the municipal governments are getting stronger. So we can have some hope that in a decentralized system like SUS, these local and state actors will be more active to keep the health systems working. Have you any thoughts about it, Ligia or Rosanna?
May I?
Yeah, go first.
I think that during the pandemic war's peak, the health system was overwhelmed. And there was a very serious crisis of lacking almost of everything, as Alicia has have shown. But and it was really a terrifying scenario. But after that, it remains a very worrying situation of disorganization, long rows of diagnosis and treatment of other diseases that were repressed by the pandemic. The structuration of many services was lost, and many relevant activities, as group sessions, cultural activities, are still not recovered. Hmm? Many specialized services interrupt the presential consultation, and that was also a factor that increased inequality, since many people have no digital inclusion. The practice of renewal of prescriptions without consultation might have led to medicalization and iatrogenics. What I'm trying to say that in this scenario, I agree with Luis that new strategies like the consortium of the we, we have in the Northwest, it's important because we need actions that must be different, must be radical. We cannot think about coming back to the normal because there is no normal place anywhere. So we need some kind of planning, we need some kind of management in the local and the regional services to do this, what I'm calling the catch up, something that like a jump, to get again in a situation that is acceptable and in which we are very, very giving attention to the inequality aspect. Because the people who are in the rows, the people who lost the studies that cannot again reschedule their surgeries, for example, are the poorest. So we need to look about that.
So may I say something? Yeah.
Of course.
So during the pandemic, the worst periods, I think for a long time, the primary care was just lost. They didn't incentivize anything. It's like they didn't know what to do. They didn't have EPI enough for everybody, so they produced inequalities. They gave EPI for physicians and nurses. They didn't give to technical nurse, the collaborators. So it was really, really bad. They didn't go to their house. They didn't provide anything. Even after they got all the EPIs, they still didn't go. They didn't return their routine. They couldn't return the routine in vaccination. I don't know in other place, because vaccine was really, really made different in every state. The governors really decide to do what they want. If you see the cries of adolescents recent, that the government suspend the adolescent vaccination, in hours, the media was saying, this state, more than 10 states said, I don't care. I'm going to keep vaccinating. So what they got was the division. Every state is working much more like United States now than a unified system. I see this loss. I see, and other thing that I know to happen was they are privatizing sectors of the system in the municipality. For example, in Fortaleza and Ceará, the state was the one that the left-wing governor had 80% of the votes. So he won in the first round of the election. But he's conducting really funny things, and the municipality too. For example, all the exams in health units is a tertiary system that is doing. It's a private system. So I'm conducting a research in the health center. When I start, I'm going to collect blood. When I have to negotiate with a private system. So it's very different. Negotiate with a system that's a governance system that you're going to provide something. It's they know the importance of the research, and negotiate with a private system that is there. Just if you're using my fridge, what are you going to give me back? You know, I'm not sure I want to share you my fridge, my centrifuge. So it's really very different. Other thing we note is the last 10 years, you can't see any admission, public admission, the way you should have. So we don't have stability anymore. Physician doesn't want to stay in the health unit. They stay there. They never know where the admission they are doing now is for 2 years, 4 years. So what's going to happen next? So this creates a very instability to the professionals. So I think I'm not only what the Bolsonaro provide was a fraction, The system is separating in all these entities that used to work together. They are. I see in the Camera technical committee for vaccination, the CONAS, the representative of the Secretary of States and municipalities, they are fighting to keep this together. It's really, they are having a hard time. So even I see that SUS was absolute essential to make the pandemic not more tragic than it was. I feel very sad that I don't think is doing well. It's really not doing well.
Yes, it's something that keeps between us the question, what could we do to go forward? It's something very important to think. Uh, I think that it's one aspect that is important, that is to recover from the mourning. As you have said, Licia, we have more than 600,000 of deaths. So it means a lot of people mourning. And we need to increase activities in and outside the health sector to provide proper care, new devices, social support. But first of all, the Brazilian social system must repair the damage and establish financial support for widows and orphans. And also, for going forward, we need to recover our dignity and hope as a country. We need justice. We need, as a nation, to believe that all the harm done won't be unpunished. That is very important. That is a health issue. We need policy to repair inequalities and to stop racism and gender discrimination against women. We need to increase the quality and the coverage of good educational programs to allow a kind of catch up for all the children that have been left behind during the crisis. I know we can do that, and I hope we try. Thank you, Luis Eugenio, very much for the invitation.
Thank you very much, Rosana. Thank you, Lydia. A very interesting, a very profound, a very deep discussion about the situation in Brazil. It's a pity that we had the participation of colleagues from Ecuador and Chile. Both had problems in joining us, but we had the opportunity to go deeper into the Brazilian situation and showing its complexity. At the same time, you have a very bad experience, but you have also, as communities resisting, and also local and state governments doing the right things. And as we had in the previous session, we see even policy makers that listen to the scientific community, to what science has said about the pandemic. So we are a complex country with good experience and bad experience. Next year, we're going to have national presidential elections. So we have as hope as a duty.
And, hope is a duty. I like this expression.
Yeah, and we should work harder to get a new democratic government in the federal government. So thank you very much to you all. We finish here our session.